Hello, my name is Nicola Esselbach and welcome to my CSB346 video presentation on clinical reasoning and decision making. To structure this presentation, I will be using the 4 R's of reflection: reporting, relating, reasoning, and reconstructing. So, what is clinical reasoning? Clinical reasoning is the process of gathering and understanding information conducted by clinicians so as to make informed decisions. As paramedics, clinical reasoning is imperative to our practice. Paramedics must make decisions from the moment that a case is dispatched, such as what equipment will be required, as well as the treatment regime. This video will explore factors that influence clinical reasoning and decision making and how we can improve in this area as clinicians. So why is this important? Good clinical reasoning and decision making ensures that no important information is missed during assessments. It aids the clinician in formulating a timely provisional diagnosis and treatment. This can allow clinicians to initiate treatment and provide appropriate cares for their patients prior to arriving at hospital. For example, for patients with meningococcal septicemia, a thorough assessment is required, including completing a thorough head-to-toe assessment to look for a non-blanching petechial or purpuric rash. Delayed identification of this rash due to a poor physical assessment can delay administration of ceftriaxone, which could cause detrimental effects for the patient. Clinical reasoning supports decision-making. In other words, a thorough assessment which is documented can support clinicians in difficult decisions. Challenging decisions include administering drugs with risks of side effects. For example, the effects of glycerol trinitrate, or GTN, can be different between patients. Some patients experience few side effects, while some patients can become significantly hypotensive, and some patients can have a syncopal episode. In a patient who is having a suspected STEMI with a systolic blood pressure of 103, a clinician is indicated with no contraindications for GTN. The paramedic must decide to risk the side effects of hypotension in this patient, as they are almost contraindicated. So it is up to their discretion whether or not to give GTN. If the clinician can justify his decision using good clinical reasoning, he cannot be liable for error. For patients who deteriorate or die, evidence of clinical reasoning is important to avoid being held guilty of medical negligence. It is important that I use clinical reasoning during my assessments to provide evidence for my decisions. In the previous example, it is important that the clinician checks all contraindications and allergies and documents this accordingly, so that if a patient does deteriorate, the clinician is not at fault. In order to have good clinical reasoning skills, paramedics rely on the ability to accurately and quickly gather and understand clinically important information. Therefore, a thorough assessment is critical to ensure correct treatment and cares are provided. A structured and systematic approach has shown to facilitate a thorough assessment. Ultimately, a systematic approach facilitates clinical reasoning. So what does a systematic approach look like? There are many components to a pre-hospital assessment. The first is a primary assessment. There is a global consensus that the DRABC assessment is the ideal tool for a primary assessment. The primary assessment should be conducted for every patient to identify rapidly if the patient is in a critical or life-threatening condition. Secondary assessments allow the clinician to develop a provisional diagnosis and formulate a treatment plan for the patient. Secondary assessments include completing a thorough history assessment and any other relevant secondary assessments, including the history of the presenting illness and previous episodes. When obtaining a history, it's important to understand the patient's entire history, not just their medical history. This involves asking about economic, social, and domestic situations. This is particularly imperative for patients who present with mental health concerns, as it provides a full picture of the patient. For example, for patients who are experiencing their first mental health crisis, it is critical to obtain a thorough history so that any support and assistance can be initiated quickly to avoid future presentations. For some patients, a thorough history assessment may also include asking about a patient's social history, such as their occupation, drug and alcohol abuse, travel, marital status, or living conditions. Some good questions to ask include: what supports do they have? Have they recently moved? Do they have family in the same city? And who is living at home with them? Some of these factors can be assessed without having to ask the patient. For example, paramedics are lucky to be able to see into the living situations of many patients, which can give an insight into their health, such as an elderly patient who doesn't have any food in the fridge but hasn't asked for help. This can be important information to hand over at hospital so that support for the person can be discussed and arranged. Physical examinations are also very important for a clinician's clinical reasoning and decision making. A good physical exam requires a systematic approach for patients who are low acuity, such as the elderly patient who has fallen over, but also for high acuity patients, such as a major trauma patient who have multiple stab wounds. Both require a thorough assessment. For my own future practice, I must remember to not rush a physical assessment, as it can be easy to miss information. For example, for patients with valvular disorders or suspected pericarditis, I should aim to auscultate the heart sounds, even though it's not common practice, but it will improve my skills over time and lead to better clinical reasoning, and myself as a better clinician. To help me improve in my physical assessment, I must continue to revise my anatomy and physiology knowledge, as it can be very helpful in making clinical decisions based off of particular findings. For example, if a child localizes to pain when I am completing an abdominal assessment, I must be able to identify the underlying structures to identify a provisional diagnosis, as it can save time for the patient at hospital. So what factors influence clinical reasoning and decision making? Clinical reasoning skills rely on good communication. Being able to listen to the patient and ask all relevant questions will assist clinicians in gathering important information to make informed decisions, such as for a patient's treatment or transport. Concise, open-ended questions and open body language will encourage patients to give clear, honest, and timely information. Listening skills are also important, as it can be easy to miss information. I must remember to keep an open mind when the patient is talking and aim to listen to what they are saying. For example, for patients who commonly call the ambulance, also known as frequent flyers, it's important that we truly listen to what they are saying, as if it were the first time they are presenting, as we don't know what they are experiencing and we should not be biased or judgmental. From the moment a case is dispatched, paramedics can easily allow bias to influence decisions. Bias can cause errors and potentially loss of life. For example, when a patient, such as a young adult who is experiencing vomiting and diarrhea, is assigned to a paramedic crew, the crew could assume that the patient has gastroenteritis and is unnecessarily calling the ambulance. Rather, the patient should treat the patient seriously, avoiding jumping to conclusions or presuming a diagnosis. Additionally, it is important to develop rapport with the patient first, prior to commencing a thorough assessment. This is incredibly important for patients who are presenting with a mental health concern. Without developing rapport, these patients may be reluctant to tell you information initially, or they may tell you false information. It can also change the depth of their answers. All patients will be more inclined to give you a clear, honest answer if you have developed rapport first. For example, for patients who are experiencing a drug overdose, building rapport may allow them to feel more comfortable and be honest with you, and truthfully telling you what substance or combination of substances they have taken. This includes being friendly, introducing yourself and your partner, asking their name, and taking time to listen to their presenting complaint, and being non-judgmental. Ultimately, good rapport with the patient creates a willingness of the patient to open up. Why is clinical reasoning and justified decision-making so important? Paramedics occasionally lack organizational support, particularly when working as a single officer or when working in remote communities with limited resources. This means that when making decisions, paramedics are under significant stress, and therefore it is important that as a paramedic, I must always be able to justify my actions and ensure there is clinical reasoning behind my decisions. Since the paramedic profession was adopted under the National Registration and Accreditation Scheme, it has changed the discipline for the better. But this change has also come with new responsibilities, requiring paramedics to adhere to professional capabilities. This holds paramedics accountable for holistic patient-centered care, which includes ensuring assessments and appropriate management or treatment. This protects the public and raises the standard which paramedics are required to meet. The nature of the work which paramedics carry out is often clinically difficult and occasionally unsafe, so it is therefore important that as paramedics, we are appropriately skilled, competent, and thorough. Personally, I fear repercussions such as litigation and unemployment as a consequence for substandard practice. The principle of non-maleficence is also applicable here. In other words, do no harm. Insufficient assessments can be grounds for medical negligence. As a future paramedic, I have a duty of care to my patients to be comprehensive in my assessments and refrain from letting bias dictate management of a patient. In summary, clinical reasoning skills are fundamental for paramedics in order to guide clinical management. Without clinical reasoning, paramedics risk undertreating or incorrectly treating patients. Good clinical reasoning relies on a thorough assessment of each patient to ensure accurate management and treatment. In my future practice, I will achieve this by utilizing a robust systematic approach. I must ensure to frequently revise my anatomy and physiology knowledge, which can be used to inform my decisions. Additionally, I must remember how bias can severely impact my clinical reasoning and cause an incomprehensive assessment. I must keep an open mind during my assessments to avoid error in my practice. When assessing a patient, I will always ensure to ask questions regarding a patient's social, economic, and environmental situations, as all of these factors contribute to a patient's health.